Will taking arnica after surgery reduce the amount of pain medications that you might need? This is something that I saw a plastic surgeon promoting on social media, and it just so happened that he was selling arnica tabs. How ironic. Let's discuss the evidence. I consider myself somewhat of an expert on this topic, considering I wrote a review paper on arnica and bromelain, which we'll talk about in a little bit. Arnica is a homeopathic medicine that has been used to decrease swelling and bruising after surgery. Now, the studies are not that convincing. Part of the reason is that arnica relies on homeopathic dosing, which nobody understands, and every study uses a different dose. So confusing dosing, not really promising results, and also topical arnica can have an allergic reactive response. So that is why I don't recommend it to my patients. And I really don't think there's enough evidence to suggest that arnica could decrease your need for postoperative pain medications. Now, what I do love is bromelain. Bromelain is an enzyme from pineapple cores and stems that has been shown in well-done randomized controlled trials, specifically in oral and facial surgery, to decrease bruising and swelling, and it does so quite effectively. Now, could we infer that if you have decreased bruising and swelling, you might have decreased pain? Yes, it just really wasn't the primary outcome of those surgeries, so I'm not as comfortable making that conclusion. Could it reduce the amount of pain medication you need after surgery? Maybe slightly, but not substantially to the point that this plastic surgeon was recommending it basically replacing your pain medication. Bromelain is found in pineapple stems and leaves, but it is not really that concentrated in the actual pineapple and pineapple juice. So that is why, unless you're making a smoothie of the cores, stems, and leaves, I recommend a bromelain supplement to my patients, 500 milligrams once a day for 5 days after surgery. The only real exception to this is if you have a pineapple allergy, then it could not be safe for you to take. So should you take these after surgery? My conclusions. Arnica, probably not worth your money, not worth the risk. Bromelain, if you don't have a pineapple allergy, probably worth the 5 days after surgery, 500 milligrams a day. But it's probably not going to decrease the amount of pain medication that you need. Have you taken either of these after surgery? If so, let me know below.